Queues for HIV testing in Rwanda. This is as a result of the release of a human immunodeficiency virus self-diagnostics kit in the country. The OraQuick single-use device allows the user to know his or her HIV status within 20 minutes. Unlike the blood test, this can be done at home.
Rwandans are generally afraid to be tested. They are afraid to go to the hospital. But I really like this kit because you can test yourself and know your status. It will give people the courage to go to hospital and find out more.
The self-test system does not require any particular expertise. The system looks for traces of the virus in saliva and not in blood. Health officials say it is 99.7% accurate.
It is one way to make sure that people have access to HIV testing. And as we know that HIV testing is an entry point to the HIV prevention in general, and it is an entry point for long-term HIV care and treatment. So we find it necessary to make sure that the test is accessible and people, they know their HIV status so they can take appropriate strategies according to their HIV result.
The kit currently costs $5 in pharmacies in Rwanda. This price is considered too high in a country where more than 60% of the population live below the poverty line.
If the tests at the factory is accessed at $2 for public programs, $4 for non-public, for private, to me, looking at who needs it is still a major barrier to scale.
Authorities expressed their willingness to work with stakeholders to reduce the cost of the self-test. Some have criticized the self-test kits, saying those receiving a positive diagnosis at home would not have access to the same counseling and support offered in clinics.